I'm Kayla, and I'm going to be doing my assessment for my portfolio project for my BSN course health assessment class. This is my ID. Kayla Nelson, that's me. This is my volunteer. This is Tanya. Tanya Pritchett. She has volunteered to do this. She knows that it's going to be published on YouTube and be published for my teacher to assess. Do you consent and volunteer to do this?
Yes.
Alright, great. So let's get started. I'm going to go ahead and step out and wash my hands real quick. Okay, now that I have clean hands, we'll go ahead and we will get started with this assessment. So my patient is a 22-year-old female of good health, only health history being migraines, and she's had her tonsils removed in the past. She takes no medications daily and no significant family history. She appears to be 22 years old. She matches that. Skin color is normal. She looks well nourished. Have you had any changes in your appetite or any unintended weight loss?
No.
Okay, good. So I'm just going to ask you a few questions. What's your name and date of birth?
Tanya Pritchett, 5/22/96.
Perfect. And do you know where you are?
Your house.
Okay, and do you know what we're doing?
A video for your class.
And do you know the president?
Donald Trump.
Okay, great. So my patient is alert and oriented ×4. Her posture and position look normal. I saw her walk in the room. Her gait was appropriate for a 22-year-old. Do you use any aids to walk around?
No.
And what do you do for a living?
I'm a nurse.
Good. I see no obvious physical deformities, and just looking at her, she can move everything pretty well. Any stiffness or pain?
Mm-mm.
Okay, great. And her facial expression is normal, and mood and affect are what we would consider normal for this age. And how about speech? Do you have any trouble making sentences, articulating your words?
No.
Good, great. How about hearing? Have you had any hearing loss?
No.
Alright, and personal hygiene looks intact and good. So before this started, we went ahead and got her on the scale, and we agreed that she weighs,
110 pounds.
110 pounds, and you're 5'4"?
Yes.
Alright. And I can use those measurements to calculate BMI at a later time. Also, before this video started, we used a line on the floor and a Snellen eye chart. She does wear glasses, and we wore the glasses during the exam, and with glasses she had 20/20 vision. Any questions?
Nope.
Okay. Okay. So we also did some vital signs along with the height and weight. We did blood pressure in her left arm, which was 110/68, and the other arm was 108/66, so that was pretty normal, and she agrees that's her norm for most days. Pulse sitting, radial pulse was 72, respirations were 18 and unlabored, and 96% on room air with my pulse oximeter, and temperature was also normal at 98.6 degrees Fahrenheit or 37 degrees Celsius. And she does not report any pain at this time?
No.
Okay. So what brings her to have this assessment is some abdominal pain that comes intermittently over the last few months, correct?
Yes.
Okay. Alright, so I'm just going to start from the top and we'll work our way down, starting with her skin. Her skin is normal. She doesn't look extremely pale or flushed. It's warm, dry, intact with good skin turgor. Do you have any lesions or sores?
Nope.
Any skin conditions, eczema?
Nope.
Okay, great. Pigmentation is normal. We'll start up here, and I'm just going to get a little personal. We're going to get in your hair. We're going to look and see what we see, okay?
Okay.
Okay, so in her hair, I don't see any bugs or lice that we could be concerned about. No lesions. What about bumps?
Nope.
Okay, I don't feel anything causing you any pain?
Nope.
Alright, her head is symmetrical. As far as her face goes, face symmetry is good. Can you smile? Good. No facial droop. Can you blow a bubble? Perfect. Eyebrows up. Eyebrows down. Okay, I'm going to try, you close your eyes tight, I'm going to try to open them. Tight, tight, tight. Alright, good. So cranial nerves that we are assessing are intact. Let's see, temporal artery. Good. Open and close. Any clicking or pain with chewing?
Clicking, but that's being addressed by my dentist currently.
Perfect. All right. And we'll go ahead and assess your sinuses. Any pain right here?
Nope.
All right. Any pain right here?
No.
Great. Perfect. Looking good. So now I'm going to use my ophthalmoscope to look at your eyes. And inside your eyes, I would look for your internal structures like your red reflex and your lens, and we could look at your cornea to make sure there's no abrasions. If I had an ophthalmoscope, but I have a pen light, so we'll do this. All right, you just look at my nose. All right, pupils are equal, round, and reactive to light. And then I want you to follow. I'm going to move the pen light towards you and back towards me, and I want you to follow it, okay?
Okay.
Perfect. And her eyes accommodate as they should. Externally, her eyes look great. Eyelashes are intact. Eyebrows look good. Eyelids, no trouble. Any watery or dry eyes?
Mm-hmm.
Okay. So to do some more cranial nerve testing and your field of vision, I just want you to follow my pen light, okay?
Okay.
Good job. Good. So we did our cardinal positions of gaze and our corneal light reflex, visual fields. So I'm going to do some silly motions, and I want you to tell me when you can see them.
Yep. Yep. Yep.
All right.
Yep.
Peripheral vision is intact. Her sclera are white, no jaundice or redness, no pink areas. They look like they should. And with my ophthalmoscope, I would also be able to see her disc and her vessels in her eyes. So far, so good. We'll move on to your ears. We'll look at both. I'm just going to inspect them first. Looks normal, no earrings, nothing draining that I can see. Have you had any trouble with your ears?
No.
If I had an otoscope, I would be using my otoscope to look in here. I would be pulling up and back to see that her tympanic membrane is intact and pearly. So we'll do the same thing over here, up and back, and I can see her tympanic membrane, no wax noted. Any trouble or pain at all with your ears?
Mm-hmm.
And you can hear fine?
Yes.
Okay, so we have a couple little hearing tests. I'm gonna come over here and whisper a little word. I'll have you cover the opposite ear, and we'll do the same on both sides.
Okay.
Okay? Cover, whoops, cover this ear.
Pink donuts, purple.
Perfect. And we'll do the same thing. Christmas trees, lights.
Christmas tree lights.
Perfect. So another little hearing test we can do with my tuning fork is I'll tap it and it'll vibrate, and I'm going to put it on the top of your head, and you'll just tell me if it sounds the same on both sides.
Okay.
Okay?
Yes.
Okay, this is called the Weber test. Now the Ren test is a little longer. I'll do the same thing. I'll place it on this bone behind your ear, and you'll raise your hand when you can't hear it anymore.
Okay.
And then I'll hit it again, put it right here, and you would raise your hand and tell me when you couldn't hear it anymore. And
Okay.
you do the same on both sides.
Okay.
And you should hear it for longer when it's not touching the bone.
Okay.
But we don't have a tuning fork, so here we are.
Okay.
Good. So moving along to your nose. Externally, your nose looks fine. Have you ever broken your nose?
Nope.
Have any sinus issues?
Nope.
Okay, great. So I'm going to look inside. Septum is not deviated. Looks good. Can you breathe in? Breathe out. And now do the same thing, covering one nostril. Good. And switch. Good. Sounds like even airflow. How about, does it feel even?
Feels fine.
Good. Alright, so good patency of our nostrils. Now let's look at our mouth. Her lips are not overly dry, so that's a good status of her hydration. Mouth is pink. The mucosa is pink. Teeth intact. Can you lift your tongue? Perfect. So can you stick your tongue out? Good. And open up and say ah.
Ah.
Uvula moves. These cranial nerves are intact as well. So that assesses our cranial nerve 12, 9, and 10.
Okay.
Okay. And let me see. We cannot know any tonsils because she had hers removed. Hard and soft palate intact and normal. Moving further down, we'll go ahead and start assessing your neck.
Okay.
Does this hurt?
No.
Alright, so we're looking for our lymph nodes here. Cervical lymph nodes, any lumps or bumps, and I don't feel any, which is good. We'll do our carotid pulse one at a time. Good. We feel the same on both sides, palpable bilaterally. We'll go ahead and we'll feel for our trachea. Can you swallow for me? Good. Symmetrical movement. And can we do left and right and then round count? Good. Any pain with that? Have you ever had any neck trouble in the past?
No.
Good. So everything looks symmetrical there. I'm going to have you, if you don't mind, spin around for me, and I'm going to not choke you even if it feels like I am,
Okay.
and assess for your thyroid. Alright, go ahead and move your head to the right. Perfect. And to the left. Great. Any pain?
Nope.
Alright, thyroid gland is palpable. While I have you turn around, I will go ahead and just do a quick listen. We'll do a Z pattern. I'm doing system number 2, so I don't need to do a super thorough lung assessment. Okay, great. If you go ahead and turn back around for me, and you can lay down. Great, thank you. So I will assess your neck. We'll listen for any kind of obvious bruise in your jugular veins with my bell. Sounds normal. Sounds normal. While I have you laying here, before we get to the root of our problem, which is the abdomen, I'll go ahead and listen to your heart.
Okay.
Okay? With the diaphragm, I'm going to listen to 4 points on your heart. We'll listen to your apical pulse for a full minute, and then I'll go back and listen with the bell as well.
Okay.
Do you have any heart issues, any cardiac
Not that I know of.
history? Okay. Any shortness of breath?
Nope.
Okay, great. And have you ever been told you have a murmur?
No.
Okay. I'm going to move my way around in the C pattern. Normal S1 and S2 sounds noted. Apical pulse is mid-clavicular between the 4th and 5th intercostal space, and I'll listen for a full minute. Great. I noted 76 apically. I'm going to come back around with the bell and listen again over your valves.
Okay.
No heave or thrill noted. Normal S1 and S2 sounds. I didn't hear any S3 sounds, which would be murmur. Okay, so now what we're here to do is assess your stomach. So the order that this usually goes is different than normal, so I'm just going to look at it first, and then I'll listen, and then I will palpate, and then percuss. I'm going to percuss, and then I will palpate after. That's different than the normal order, okay? So I'm just going to pull up your shirt. The symmetry of her stomach is symmetrical. She is flat. She's not convex or concave. Skin pigmentation is normal. Her umbilicus area looks normal as well. No discoloration, no protruding or hernia-like observations that I can see from here. So I'm going to go ahead and listen. For the diaphragm. Are you hungry?
Yes. Very.
Very active bowel sounds in all four quadrant. I went from, did the top first and then did the bottom. To determine if somebody has absent bowel sounds, you have to listen for 5 full minutes before you can call them absent. Hers are very active at this time. So you can also listen for vascular sounds like the aorta. I didn't know any of that at this time. So now we'll go ahead and we'll move on to percussion. I should be able to tap out the approximate area of the liver in the mid-clavicular line. But to palpate the spleen would have to be very enlarged for me to palpate it, which would be an abnormal finding if I could palpate it. So we'll go ahead and I will try to percuss. Any pain?
No.
Okay. All right, let's see if we can note out a liver here. Percussion seems normal at this time. No spleen noted. Like I said, that would be an abnormal finding. We'll go ahead and I'm going to do some palpation and I need you to let me know when it starts to hurt, okay?
Okay.
All right. This is just going to be some light palpation. Epigastric area. Any pain?
Not really.
Okay. We'll do deep.
Kind of right there.
Right there, okay. And right lower.
No. No.
Okay. I'm going to reach around and see if we can feel your kidneys. Does any of this hurt?
No.
Okay. Let's see what else we have. While I have you laying down, I'll go ahead and cover up your tummy, and we'll let the doctor know about those findings, and we'll go ahead and we'll look at your lower legs, okay?
Okay.
So I don't notice any deformities. Have you ever broke your legs?
No.
Okay, great. Looking at her skin, she's shaved but no abnormal hair patterns. The color is good, temperature is good. Her toes are not cold, they're the same temperature as her legs, which is good. Can you push down against me? Pull up. Pull up, good. And can you move your ankles around in a circle? Great. We'll go ahead, we'll move your knee up. And this side we'll do the same. Range of motion in your knees are good. Any pain with that?
No.
Alright, great. While I have you like this, we'll go ahead and I'll see if I can feel for a popliteal pulse. Okay, present on both. We'll do the posterior tibial. Present on both. And our pedal pulse. Great. Present on both bilaterally. You can go ahead and lay your legs straight. And then do we have any hip pain?
No.
Alright, great. Can you bring this leg out like this? Okay, great. And do the same for the other leg? Great. Do we have any other concerns?
No, just the intermittent pain.
Okay. And it was in that right lower quadrant. Does it get better with rest?
Yes.
Okay, have we had any nausea or vomiting?
One time, but not since then. That was about a week ago.
Okay, any diarrhea?
No.
Do we have bowel movements daily?
Most of the time.
And your last menstrual period?
About 2 weeks ago.
Okay, great. I think I have enough information that I will pass on to the doctor. Thank you for participating.
You're welcome.